Thank you, Mr. Chairman. I appreciate it very much. And again, I represent over 100,000 seniors in the Tampa Bay area, and they seem to be very pleased with Medicare Part D. And I, along with Dr. Gingrey, if it ain't broke, don't fix it. Mr. Blum, specifically, I'm concerned about CMS's reinterpretation of the non-interference clause of the Medicare Part D statute. It was clearly written so that CMS would not interfere with the negotiations between drug manufacturers, pharmacies, and Part D sponsors. You may or may not know that I'm in a unique position here since my father, Congressman Mike Bilirakis, was the chairman of the subcommittee. And again, he remembers the intent of the law as written by him and his colleagues, and it was not to allow CMS to interfere in any of these negotiations. And I was in the legislature at the time in 2003, and I followed this as well, and that was my interpretation of the law, that the intent was for CMS not to interfere, but not to allow CMS to interfere again in the negotiations. You should know that, of course, you were I believe you were on Senator Baucus' staff at the time, so I'm sure you remember. So I'd like to ask you, Mr. Blum, are you telling me that the authors of the legislation, of course, including my father, are wrong when they say that they intended for CMS not to interfere in these negotiations?
So, going back to my days on the Senate Finance Committee, I worked with your father and his staff during the conference committee that produced the final Part D legislation. And so I understand well the intent of the Congress at the time. Senator Baucus, my former boss, and the team that he had, myself included, were directly involved in the drafting of the Part D legislation. So I understand well why Congress chose to put in place the non-interference clause. While we understand the disagreement, and it's clear from this hearing today, there is a disagreement. We propose the change with the interest to make the provision work better, to have it be stronger, to make it really clear when CMS will and won't get involved with contract disputes with Part D sponsors and pharmacies. We get asked frequently to get involved with those disputes. We wanted to kind of articulate to the public when won't CMS will try and broker beneficiary access issues or pharmacy network issues. We will thoroughly review, and I look forward to looking to the CRS document to understand our authority, to make sure that our legal team understands it, but as it said several times during this hearing, our intention is not to interfere with the price.
Thank you. You understood the intent of the law then, and now you understand it as well.
Having served on the Finance Committee staff during the 2003 drafting, I understand the 2003 legislation well.
Thank you, sir, because I don't have a lot of time. I want to get on to the next question. Appreciate it. You justify some of the changes in the rule as a means to address prescription drug abuse. It seems to me that we could manage some of the prescription drug problem through the use of pharmacy lock, the lock-in program, where a single point of sale could provide more protection against the problem of doctor shopping, pharmacy shopping, and inappropriate drug therapies for high-risk beneficiaries. Pharmacy lock-in has been used successfully in state Medicaid, of course, as you know, and also with TRICARE and commercial insurance. Are you in support of pharmacy lock-in, sir?
I have testified on the record last summer to the Senate Homeland Security Committee that we believe lock-in provisions can help to reduce inappropriate prescribing, prescriber fraud. We have concluded that Congress would have to act to authorize us to allow pharmacy lock-in, but we believe that's a change that Congress should make.
So in other words, you agree with the pharmacy lock-in. Why isn't it in this particular rule?
We don't have the authority for that change, and I have testified that Congress would have to give us that authority.
Okay. I've introduced a bipartisan bill on this particular issue, but staff at CMS have not replied to requests from this committee for technical assistance on this bill. Today, would you commit to me, you personally, to review this legislation that I've offered. I've actually filed it. It's been
Absolutely.
about a few months. So I'd like to get your feedback with regard to this legislation. Would you personally commit to me that you will review that and respond to me?
Absolutely.
Okay, thank you very much. Appreciate that.